Texas received 520,425 first dose vaccines this week. They went out to 344 Texas providers around the state, and that includes 82 hubs. The increase in the vaccine this week was due to a 30% increase from the federal government of the Moderna vaccines. We had a little more available this week. And then there was also a portion of unused Pfizer doses that had originally been allocated through the long-term care facility federal partner program that went unused. And so they funneled those back in through the pipeline. And that led to a little bit of an increase as well. So Texas has now, and you may have heard the governor talk about this on his State of the State address the other night. As of the end of last week, I think that was Texas had administered 2.1 million doses. If you'll remember, it took us about a month to administer 1 million doses. And then we had already exceeded 2 million doses 2 weeks later. So I think that everybody is, along with getting more efficient, they're continuing to send it out to more and more providers. So this is helping the vaccine to get out much quicker. This week in Abilene-Taylor County at our hub, we were allocated 1,460 doses. It is again the Pfizer. So we anticipate that we will be able to get a 6th dose out of some of the vials anyway. The problem with that has been that if you're allocated, 1,460, and they give you enough of the little small needles specifically designed to get that extra dose out, once you run out of that supply that they send you, if you don't have that special kind of needle or that small needle available at the syringe, then you're not able to pull off that 6th dose. So we anticipate we'll be able to get the 6th dose out of many of them, but at some point that will probably stop and we'll be getting the 5 doses out. So not quite sure how many that 1,460 doses will turn into, but we anticipate that it will be somewhere around 1,600 doses that we're going to be administering. We have been told by the state, again, nothing is set in stone until it happens, but next week we should be allocated the 2,925 doses for our hub, which will turn into hopefully somewhere around 3,500 doses once it's all said and done. So supply is expected to increase for us at our hub. Next week, we are planning right now to split that into 2 hub events, one on Tuesday and one on Thursday. So we'll split the doses in half and administer that way. At Friday's hub, we administered about 1,250 doses. We reserved about 120 that were for a long-term care facility that had not gotten a date from their federal pharmacy partner. And so they reached out and we agreed to go ahead and reserve some doses for them. So that facility was taken care of this week. I believe it was the Wesley Court Assisted Living facility. So we finished up that facility along with what we administered at the hub. We've changed our procedures just a little bit just to kind of, again, try to tweak things to improve efficiency. We are now leaving one message. So we reach out to them. If they don't pick up, we leave one message. They're given a direct callback number to reach that exact same person that called them to try to facilitate getting a hold of more people. I think I mentioned last week or the week before that it took somewhere in the neighborhood of calling around 700 people in order to schedule about 300 people. So it has proven to be very inefficient, very time consuming and cumbersome on staff to try to call out and schedule appointments. So in keeping with what we really, we want to try to improve the process every week. We're learning each week. And I think this week what we have decided to do is because the hub is a day earlier and we didn't have as much time to schedule these appointments out, what we're going to do, because at this point we've got somewhere in the neighborhood of around 700 appointments scheduled, and we plan to start at 7:30 in the morning. And so obviously I don't think we have enough time to fill that schedule. So we're making plans to have a scheduled line and an unscheduled line. And what we're going to ask is that those people who have signed up on our waiting list, they will be funneled. If they want to come tomorrow, we're going to ask that they wait until 9:30. We normally, at all the other hubs that we've hosted so far, we have a pretty decent rush really early in the morning. So it's pretty hectic, and it's also a time where you've still got our clinical staff are still drawing up doses. You can't draw them too soon because they'll time out. With this, you've got to make sure that you administer them before they time out. And so we can't draw up a bunch of doses an hour or two early to be prepared. We can only start drawing up doses, about 20 to 30 minutes before we anticipate that first rush. And so it always creates a little bit of a rush on things in the morning. And you've also got a lot of people who just arrive early. This is an early crowd. So we anticipate that will be the same again tomorrow. And so we're not going to open up that walk-in line until about 9:30. It will be funneled through a different door. We are making arrangements to where hopefully people will not have to wait outside. But if the line grows too long, people should be aware that you may end up having to wait outside. We're going to do our best to have a setup where that line will snake through the exhibit hall. And we have no idea what to expect since we have not done it this way before. But the goal is to get all of those doses into arms. And because we haven't had enough time to schedule out those appointments, people can either try to call us for an appointment. What we're ramping up right now is trying to take people off of actively calling out. And as those phone calls come in, we're going to try to funnel those out to all those same people that we're calling. The problem is that a lot of those people have cell phones, and our phones don't transfer to a cell phone. And so we're trying to quickly look at how do we adjust so that we can receive those calls. But people should know that the capacity for incoming calls is not as big as we want. And so if they call and they don't get an answer, they will just have to continue to try to call. We'll do the best we can with fielding those calls. And we'll try to continue to schedule appointments, but there will be, and we'll try to update at the end of the day how many slots are unfilled, so that way people can determine, whether they want to go and try to do a walk-in. And we will try to communicate that information so that people aren't, if we end up filling them by the end of the day, we'll communicate out that all the slots are filled. And so make sure that you continue to watch our social media page, our website. I'm sure you all will help us get that information out as well. And so we will do our best to communicate with as many people as possible on where we are in filling those slots. Keep in mind that you can still call CityLink for a ride if you do have an appointment scheduled for your vaccine and you don't have a ride. The CityLink number is, you may all actually, I thought he was sending it to me and it's buried somewhere. Okay. 3257. Oh, sorry. I was going to give out somebody's personal number. Anyway, we'll get it. We'll get it to you, and you all may have it somewhere. So you could still call CityLink for a ride. I think I mentioned we're leaving one message and moving on. People need to make sure that they call back if they do want the vaccine. But once we leave a message, we will not continue to call that number anymore. So that's something that will be a little bit different. I was asked this question and by a couple of different people. So I did have staff pull some data about, as a hub, we are required to target at-risk populations, underserved populations, populations that have been disproportionately affected by COVID. And so we've been looking at some data and trying to brainstorm about how we target specific groups. But I will say that our data continues to show that the most impacted zip code anyway by deaths due to COVID have been 79606 zip codes. And if you live in Abilene, you know that that's one of the wealthier zip codes. So it's a little bit surprising. It veers from maybe the national data that's out there that some of your poorer areas. We've tried to determine why that is. And it could be because they had, well, the death data I think is a little bit hard to explain this way. The number of positive cases also, the majority of them in our area have also been out of the 79606 zip code. And we thought that may be because they had more access to testing. So I'm not sure, how to interpret that because like I said, you've seen the national data that says the low socioeconomic and then the people of color. The majority of our cases and our deaths have been in the white category. And so I don't know why that is. It seems to be a little bit of an anomaly. But having said that, we are still looking at ways to try to target at-risk populations, at-risk employers. So if there are large facilities, large groups that are having to work in close quarters, we're trying to work with those to at least get their 1B people vaccinated. And so we'll continue to do that and focus. We did AISD last week. And so we've reached out to other school districts, Wiley ISD, Merkel ISD, and GymNet ISD we've targeted this week. And so they're still sending in their rosters for people to get vaccinated. So we also are relying on our partners through the Basic Needs Network to target those maybe who are the underserved population, uninsured people, people who just don't have as much access. And so we've continued to try to funnel information through them to get our messages out and to facilitate people getting signed up for vaccine. Yes, next week will be Pfizer as well. Pfizer is more readily available than the Moderna vaccine right now. And so we are getting Pfizer next week. We have focused a lot on like the refugee community. We've got a refugee program here. And so we work closely with the IRC. We have a nurse who is in the refugee program. And so she has been preparing information and reaching out to the leaders of a church group. So educating those who speak English within that group who can then go out and educate their people. What they're finding is that there are a lot of people who are saying they don't want to take the vaccine. I think that they are still nervous. They don't understand it completely. And so our goal, when we initially reached out, we were like, here's how to get on the sign-up sheet. And we were asking them to share that information with their groups of people. And the response back was, we don't have people who are interested. So that tells us we need to do more education before we can actually get them signed up. So that's what the focus has shifted to is let's prepare we've got a frequently asked questions, but we're trying to tailor it specifically to what their fears are. And so we're reaching out to the IRC, to the Housing Authority, and I said I would this morning and I haven't had a chance, but I'll reach out to like the Abby Mar, who employs a lot of them. and see what kinds of information or feedback they're getting. If they're willing to have conversations with them to say, what are your fears? What are your reservations? What information do you need to be able to help share our messages? And so that's how we're working to try to educate first before we just say, get on our sign up sheet. We know that there is no way to prevent the frustration that's going to happen. So we're going to try to minimize that as much as possible. Those people can call, even if you don't get in today. We've built the schedule out for next week's vaccine clinics. And so if they can give us a call, we can go ahead and get them scheduled for a specific time. And that way they don't have to wait in the line. We acknowledge that there are people who will not be able to wait in line. I know they desperately want a vaccine. And until we get our new system rolled out, there's no other way around it. I don't know how to make it more efficient. We thought that calling people would be the most efficient way to do that, and it has proven not to be. And so we're working as best we can, but they can still call. They'll have to be patient. You can also try to send an email to the, I'll have to get it for y'all. It's a vaccine email. So we may look at opening that up. And if we do, then we can share that information with y'all where people might be able to sign up that way. I do not know where we will be once we do this, for the entire day of accepting calls rather than outbound calls. I don't know where we'll be at the end of the day, but that's where we can communicate that information with you all, and you can help us get information out. In the morning, if we see that all of those appointments have been booked out, we'll communicate that with those that show up and, offer them a time on our next clinic. And so we'll adjust quickly how we need to, but I don't know what to expect. We're still focusing on the 1A and 1B categories. So we're still asking those folks, the ones that have signed up on our wait list should be the 1B categories. Any 1A, any medical care people that still have not been vaccinated that want it, they can still come, but you do need to be in the 1A or 1B category. So at this point, everything we have ordered for second dose has come in. So I'm not concerned at this point. We will be calling everybody who has taken a dose from us up to this point. What we've said is we will call you to set up your second dose. So for those 3 clinics that we've done, and then the ones that we've administered here just out of the health department before we started doing hubs, that's the plan. We'll call them for the second dose. Starting tomorrow, what we'll do is, since we already have since we are getting more routine allocations for vaccines, we've been able to establish what our schedule will be. And so when people arrive tomorrow, their vaccine card that they'll be given, it's going to have their next appointment on it. And so we'll go ahead and schedule that when they come in. Well, I can say that the data is very good. And it says that even though your second dose may make you feel a little bit crummy, I think it's all perspective. Some people react more to being uncomfortable. That's actually a good sign. It should not last long. It should not last any more than a day or two. And if it does, you need to contact your doctor. But people feeling kind of crummy is a sign that is working. It has triggered an immune response in your body, and your body is learning how to respond when it sees that. So if you were to be exposed to COVID later, your body has built an immune response previously and it knows how to react. That's going to actually protect you. So I think that it's just our mindset. We're not used to feeling any discomfort. We want to immediately take something and have it go away. But that is triggering an immune response. It is expected with your second dose that you will feel a little bit more after your second dose than you did your first one. What we're hearing, a lot of people are reporting on the first dose, they have nothing other than a really sore arm. On the second dose, we've heard people say that they just feel achy. They have muscle aches. Some people have experienced a fever. They're feeling kind of crummy, but it does not last long. Even for the people who have reported that they felt pretty crummy, it lasted a day or two and it quickly resolved. Those are good signs. It is not anything to be scared of. If it lasts for 3 days or more, you should reach out to your doctor and discuss that with them. That's where we're going to rely on our partners. And I know I heard Maury talking about our conversations about how to get it out on the Spanish channels. We're limited by the number of people that we have in-house that are fluent in Spanish, and so that's unfortunate. But we have made sure that a lot of our materials on our websites are available in Spanish, so we post them as well. And then just, again, relying on our community partners who deal with those groups of people regularly to try to encourage them to share that information out with them. So that's, I was talking to staff just yesterday about the frustration that we don't have a whole community outreach team. I've been seeing, like, in the big cities where they've literally got teams of people. Their job is to do nothing other than go out and do community outreach. I don't have that kind of staff. We are functioning with bare minimum people. We've tried to bring on as many people as possible to handle the functions that we have to do to create the hubs and staff them and get information out. Everybody is wearing multiple hats, but I don't have a whole team that just is going to do community outreach, unfortunately. So we're having to rely on our community partners. And I continue to meet with those people to share information and say, please share out further. Okay. I'll make sure that Maury has the information as far as where we are on scheduling and if we are still going to move forward with having a walk-in line. But as I said, for now, that's the plan, unless we see that we've gotten everything scheduled out, and y'all can help us get that message out as well.